Hi there, and welcome to the Childhood Lead Poisoning webinar. My name's Stacy Hampton. I've worked for the Riverside County Department of Environmental Health for 13 years. I started in the food program and continued with foods for 9 years. Then I moved over to land use and water resources management and worked that program for 3 years. In 2018, I started my journey in the Environmental Cleanup Program, or ECP. The CLPPP program has been a component of ECP since 2018. Our department has participated in the Childhood Lead program since 2005. So this presentation is divided into two parts. Part one is going to be an overview of the Childhood Lead Poisoning Prevention Program. In part two, we're going to take a closer look at actually managing a case of childhood lead poisoning from start to finish. So let's start with part one, the overview. The acronym for this program is CLPPP, which stands for the Childhood Lead Poisoning Prevention Program. Each county that participates in a CLPPP program is funded through a California Department of Public Health grant and therefore works under the oversight of CDPH. A local CLPPP program is comprised of a team of public health nurses and environmental professionals who are licensed by CDPH. In 2019, I became the primary environmental professional for the Riverside County Childhood Lead Program. The backup environmental professionals for CLPPP are Daisy Ciudad-Real and Alberto Lopez. Christine Kim is the supervisor and Greg Reyes is the chief. In the overview, we will learn that the Childhood Lead Program is concerned with answering three main questions. Question number one, what is the problem with lead, right? Why should we be concerned? Question number two, how do we identify the cause of the problem? And question number three, what is the solution to the problem? And this overview is going to touch on these three concerns: the nature of the problem, the cause of the problem, and the solution to the problem. Let's consider that first question of our overview. What's the problem? What's so bad about lead? Well, dangerous levels of lead can be found in everyday items and in our environment. For those of us who have worked in the food program, we are familiar with recalls of lead-contaminated candies. Lead contamination can be detected in many imported items, such as pottery, spices, medicines, makeup, and the like. There are many hobbies that could lead to lead exposure, such as shooting, fishing, working with stained glass, even melting lead bullets. Old mini blinds are also known for containing lead. In 2018, if you'll remember, there was the Flint, Michigan water crisis, where lead from aging water pipes leached into the water supply, exposing over 100,000 residents to dangerous levels of lead. Now I'd like to bring your attention to the pre-1978 house on the bottom row. Lead-based paint was banned for residential use in 1978. Now, intact lead-based paint is not a problem. Lead-based paint becomes a problem when the paint begins to deteriorate and generates lead-contaminated dust, and we'll talk more about that in a bit. In addition to the items on the diagram, there are also different types of lead-generating facilities. These types of facilities include facilities such as battery manufacturing plants, lead smelting operations, shooting ranges, and the like. Working at these facilities can lead to an adult bringing home lead dust with them on their clothing and can ultimately lead to their child being exposed to lead. Of course, there's also an occupational hazard for the adult if he inhales the lead-contaminated dust generated at the facility. Taking a look again at that first question, what is the problem with lead? We need to consider what lead does in the body. Lead is a poison. It is a neurotoxin. Lead mimics calcium and hijacks calcium's role in the brain. When lead enters the body of any human, adult, or child, it can cause dysfunction in every organ system. The title of an occupational lead hazard video sums up perfectly the effect lead poisoning can have on the adult brain. The name of the video was, "He is Not the Man I Married. Could it be lead?" Also notable in adults is the effect lead has on both the male and female reproductive systems, which could interfere with the ability to conceive. Children are especially vulnerable. The age group most at risk is children 6 months to 6 years. Lead poisoning in children can lead to developmental delay, lower IQs, and behavioral problems. What is so heartbreaking about all of this is the damage is permanent for adults and children. So those behavioral problems can wind up affecting an individual into their adulthood. That is why it is so crucial to take serious measures to prevent lead poisoning. In the CLPPP program, we focus on the case management of children up to age 21. Although there are symptoms associated with lead poisoning, such as headaches, digestive problems, and behavioral problems, sometimes there are no symptoms at all, which is quite scary considering the damage lead can do in the body. A blood test is the only way to determine if an individual has lead poisoning. There are two methods that clinics use to test for lead. The first method is a capillary draw, also known as a finger stick. A capillary draw is used when a child's veins are too small for a venous draw, or it may be an option if a child is too scared for a blood draw. The only problem with the finger stick is it often yields false positives. The public health nurses find that the clinics aren't always conducting the finger stick test properly. Some parents report clinicians didn't clean the child's skin before doing the finger stick. So our public health nurses are required to provide finger stick training at clinics to ensure they are performing capillary draws correctly. The second testing method is the venous blood draw. This method yields an accurate result and is used as a confirmatory test. Each medical provider reports the test results to the state. When test results indicate a child has an elevated blood lead level, the state will forward the case to the respective local CLPPP program. CDPH defines a case of childhood lead poisoning in one of two ways: 14.5 micrograms per deciliter or above when one blood draw has been taken venously, or when two blood draws taken a minimum of 30 days apart each yield a test result of 9.5 micrograms per deciliter or above. But note that the second draw must be confirmatory. That is, it must have been taken venously. Now, the state does want local CLPPPs to provide public health services for children with elevated blood lead levels, even if they don't meet the state definition. When children have a blood lead level at 4.5 or above, CDPH requires that public health action be taken to ensure the child's blood lead level does not increase, but is instead lowered back down to a level below 4.5. So, is a blood lead level of, let's say, 3 or 4 acceptable for a child? Well, the answer is no. The Center for Disease Control asserts that there is no safe level of lead for children. Ideally, the test results should be non-detect for lead. Even a small amount of lead can cause developmental delays and other physiological dysfunction, and this is why it is CLPPP's mission to discover the source of a child's lead poisoning and eliminate it as fast as possible. So this ultimately answers the first question of our overview. What is the problem with lead? It is a poison, and there is no safe lead level for children. Let's look at that second question of our overview. What is the cause of the elevated blood lead level? What is the source of lead exposure? And how did it get into the body? There are two main pathways in which lead enters the body. For children, the main pathway is through ingestion. Young children often have the habit of putting everything in their mouth, whether it be unwashed hands or any object they could get their hands on. Children crawl on floors, then put their hands in their mouth. We recently had a case child who liked to lick the floors. When children put lead-contaminated dust, candy, or objects in their mouth, they ingest the lead and become lead poisoned. Inhalation is the most common pathway for lead to enter adults. This is usually related to an occupational hazard, such as working in a battery manufacturing plant or a gun range, where lead dust and fumes are inhaled by a worker. Although this overview will focus primarily on pathways and sources of lead contamination as it pertains to a child's lead poisoning, as noted before, it's important to understand that a parent's occupation could lead to a child's lead poisoning if the parent brings the lead contamination home with them on their shoes and clothing. In order to determine what caused the child's lead exposure, the CLPPP team is going to consider every possibility. Was it a toy? Is there a parent at home with a hobby that generates lead-contaminated dust, such as working with stained glass? Was the child chewing on a lead-contaminated piece of jewelry, such as this barrette that was found to contain 630,000 parts per million of lead? Was it imported lead-contaminated candy? Although each member of the CLPPP team is interested in investigating all possible sources of lead exposure, it is the environmental professional that is specifically charged with evaluating the child's environment for lead hazards. It is the job of our department to determine if there is deteriorated lead-based paint in the interior and/or exterior of the home, to determine if there is lead-contaminated dust in the home. The lead dust could come from deteriorated lead-based paint, or it could come from a parent's occupation or hobby. We had one parent who was refurbishing old barn house doors in his garage, an operation that generated lead-contaminated dust that ultimately poisoned his toddler. There was another parent who was melting lead in order to make homemade lead bullets in his garage, another operation that generated dangerous levels of lead-contaminated dust that his child was exposed to. The environmental professional is also looking to determine if there is lead-contaminated soil in a child's play area. This lead contamination is often caused by proximity to deteriorated lead-based paint on an exterior surface of the home. Lead-contaminated soil can also be associated with a parent's hobby if it generates lead. And finally, the environmental professional must determine if the child's water source is contaminated with lead. This contamination could be from old pipes containing lead or lead solder that was used for a plumbing repair. To summarize, it is the responsibility of the environmental professional to determine if the child was exposed to unsafe levels of lead in paint, dust, soil, and/or water. We're still looking at that second question of our CLPPP overview. How do we identify the source of the child's lead exposure? In order to identify the lead hazard, the CLPPP team must conduct a full investigation. The investigation is a home visit conducted by the CLPPP public health nurses and the environmental professional. CLPPP team members interview family members to determine if there was any recent travel out of the country, any remodels to the home, or any hobbies that might involve lead, such as stained glass, hunting, or fishing. The public health nurses are also going to evaluate the child's eating habits and level of development. During the investigation, the CLPP team is going to inspect the contents of the home, as well as the building components and the environment. The public health nurses are going to test the surface of suspected items using lead check swabs. They test each and every toy in the home for lead. They test ceramic pots to see if family members are using imported cookware that may have lead-based glaze. They test mini blinds, jewelry, figurines, teacups, and the like. Meanwhile, the environmental professional evaluates the environmental components of the home using an X-ray fluorescent spectrometer, or XRF for short. The XRF has a sealed source of radiation in the form of the cadmium-109 isotope. When an environmental professional wants to analyze the concentration of lead in paint, dust, or soil, we place the barrel of the XRF in direct contact with the sample and pull the trigger. When the trigger is pulled, gamma radiation is directed at the sample, which causes a tightly interheld electron to become dislodged, and an electron from an outer shell takes its place, which generates energy in the form of X-ray fluorescence. This resulting X-ray fluorescence is detected by the spectrometer, which determines the concentration of lead in a sample. Because of the sealed source of radiation, you do have to have a state license in order to operate the XRF. The XRF cannot analyze lead in water, so water samples have to be shipped to the lab for metals analysis. To summarize the methods used for testing suspected materials for lead, public health nurses use surface lead check swabs on toys, ceramics, jewelry, etc. The environmental professional uses an XRF to analyze lead in paint, dust, and soil. And a laboratory is utilized to analyze lead in water, candy, spices, art supplies, and so on. Although the XRF does check for lead in paint, dust, and soil, we will send dust and soil samples to the lab as well as a confirmatory test to ensure that the concentration that the XRF detected is actually correct. We still need to fully answer that second question of our interview. How do we identify the source of lead exposure? In order to identify the lead hazard, we must be able to interpret the results of the investigation. In order to interpret the results, we must know the state lead hazard levels to determine if an item or sample is above regulatory levels. For paint, anything at 1 milligram per centimeter squared or above is considered to contain lead-based paint. For dust, interior floors must be below 10 micrograms per square foot, and other interior horizontal surfaces, such as windowsills, need to be below 100. These are highlighted in yellow because in January 2020, the state reduced these levels from 40 for floors and 250 for windowsills to the much more conservative levels of 10 and 100 respectively. For soil, a child's play area must be below 400 parts per million. All areas that are accessible to a child are considered to be a child's play area. For CDPH, the Childhood Lead Poisoning Branch, levels for lead are high compared to the Department of Toxic Substance Control cleanup levels for residential areas, which the regulatory standard is only 80 parts per million compared to that 400 for CDPH. Because of this disparity, I always highly recommend some type of soil remediation when lead levels are elevated above the common levels we see at a residential home, which I usually see around 10 parts per million or 40 parts per million or so. According to California regulations, water should be non-detect for lead. Here is an example of a lab analysis report for soil. We see there were several soil samples taken and shipped to the lab for analysis. In this report, 3 soil samples were found to be well above the regulatory standard for soil, which, if you'll remember, is 400 parts per million. The soil was in the child's play area, so we can assume this lead-contaminated soil contributed to the child's lead poisoning. Other lab reports that we might see would reveal if there was lead found in spices or dust. And if you'll remember, even though we use the XRF spectrometer for analysis, the state wants us to send in dust and soil samples for confirmation testing. Usually, we don't send in paint samples because it would be destructive to remove paint from walls and other surfaces in the home. Let's take a look at answering the third question of our overview. What is the solution? We have discussed the problem with lead. We covered how we identify the source of lead exposure. And now let's talk about what we do to reduce or eliminate the lead hazard. And ultimately, how can we hope to prevent lead exposure in the first place? Once the investigation has been completed, the public health nurses and the environmental professional have tested and analyzed suspected items in the home and environmental components, and the results have been interpreted. And hopefully, we have been able to identify the source of lead exposure. Now it is time to take action to reduce or eliminate any identified source of lead exposure so the child's blood lead level will decrease, ideally to a non-detect level. Did the interview reveal Dad works in a lead-generating occupation and is bringing lead dust home on his clothing? Is Grandma having tea parties with the case child using teacups that contain lead-based glaze? Did lab analysis reveal the source of lead exposure was something the child was eating, such as imported candies from Mexico or spices from Afghanistan? One case child was found to be eating fried crickets, also known as chapulines, which her grandmother had bought at a farmer's market in Oaxaca, Mexico. She was eating them like candy. And what is the EPA standard for candy? Candy must not be found to contain more than 0.1 parts per million of lead. But these crickets were found to contain 3,100 parts per million of lead. In these cases, we're going to advise the family to discard the lead-contaminated items or keep the items out of reach of the child. If a parent is bringing the lead contamination home on their clothing, the nurses will educate parents on preventing take-home exposure. Josh Lindsay of Special Projects has created an excellent video on preventing take-home exposures. There is a link on the clip page of the Environmental Health website at rivcoeh.org. Alternatively, did lab analysis reveal it was an environmental source of lead exposure? If lead hazards were identified in paint, dust, soil, or water, we need to inform parents and property owners of the location of the lead hazards. A report will be issued to the family and property owner. The report will have a floor plan with a drawing of the home and all lead hazards called out. The property owner will be issued a notification which requires them to reduce or eliminate each source of lead hazard exposure. As time goes on, we follow up with the family and property owners to ensure the prescribed lead hazard control work is taking place. Even though lab results can take up to 2 weeks to come back, remember, we performed XRF analysis of paint, dust, and soil that gave us preliminary results on site. Based on these preliminary results, we are able to provide immediate recommendations to the family so they can start the process of eliminating the child's exposure to the lead hazard. There are two main types of lead abatement. The first is temporary lead abatement. This type is an interim control. It does not require a certified professional and can be performed by a property owner. Temporary abatement includes stabilization of lead-based paint, covering lead-contaminated soil with landscape bark or other type of landscape covering, or treatment of friction surfaces at doors and windows, for example. The second type is permanent abatement. This does require a CDPH certified professional to ensure the abatement is truly permanent. This usually involves the complete replacement of a building component, or it could involve the encapsulation of a building component, where the encapsulant is installed by a certified individual and must be warrantied to last for a minimum of 20 years. Following any type of abatement that was required by this department, a clearance inspection will be conducted by the CLPPP environmental professional to ensure the lead hazard control work has been completed as prescribed and that there is no lead contaminated dust remaining from the control work. In order to safely abate a lead hazard, basic lead-safe practices must be diligently followed. These include contain. When a property owner or lead professional is performing lead hazard control work, the last thing they want to do is spread the lead contamination to other parts of the home or neighborhood. They will install plastic barriers to ensure the lead hazard is contained. Control. They'll want to ensure that lead dust is not allowed to become airborne as much as they can help it. So they're going to use wet methods to scrape any lead-based paint during paint stabilization. And finally, cleanup. Once they have removed the deteriorated lead-based paint from a surface, they'll want to ensure they're not contaminating that surrounding area with lead-contaminated waste. So they're going to clean up properly and have a hazardous waste hauler pick up the waste. Now notice that each lead hazard worker has adequate personal protective equipment to protect themselves during cleanup operations. So you'll want to remember the key lead abatement principles are contain, control, and clean up. It is important to note that there are prohibited lead abatement methods. These methods must never be used when remediating lead-based paint. The prohibited lead abatement methods include open flame burning or torching, using heat guns operating above 1100 degrees Fahrenheit, machine sanding or grinding without a HEPA vacuum exhaust tool, abrasive blasting or sandblasting without a HEPA vacuum exhaust tool, paint stripping in a poorly ventilated space using volatile paint stripper, or dry scraping. These methods are illegal. Use of these methods usually come to our attention from a tip or a complaint. And the most important aspect of that third question is, how do we prevent childhood lead poisoning in the first place? First of all, we need to increase awareness of childhood lead poisoning and reach out and educate families as to how they can protect their children. It is important to encourage parents to have their children tested for lead so that lead in a child's blood can be detected at an early stage so that any source of lead hazard can be identified and eliminated before the child's blood lead level continues to rise. The state of California is currently taking steps to enact new policies that would require all children to be tested at specific milestones. In addition to educating families, it is important to properly educate property owners and contractors as to the hazards of working with lead-based paint in case they decide to attempt to remodel a pre-1978 home that might contain lead-based paint without using lead-safe practices. If it comes to our attention that a property owner or a contractor is generating a lead hazard by remodeling or remediating a home using prohibited lead abatement methods, we will take legal action to stop the dangerous lead practice. As previously stated, this illegal activity usually comes to our attention through a tip or a complaint. Complaints often come from another enforcement agency or even a neighbor who is aware that remodeling of a pre-1978 home usually means a disturbance of presumed lead-based paint. In this case, the environmental professional is going to take progressive enforcement actions, issuing a cease and desist order, along with an order to safely abate the lead hazard. It is important to remember that we are trying to prevent a child from being exposed to this lead hazard in the future. Therefore, it is imperative that we respond to complaints of this nature. And then we are going to provide guidance to families and property owners as to how they can safely reduce or eliminate an identified lead hazard in their home. It is often the case that the only time we're able to provide such guidance to a family or a property owner regarding lead-safe practices is when we are responding to a case of childhood lead poisoning or a complaint of someone generating a lead hazard. Ideally, we would be able to provide this guidance to families, property owners, and contractors before a lead hazard is generated, but this isn't always the case. It is our goal to increase awareness and find creative ways of reaching out to families and property owners so we can educate and offer guidance before a child is exposed to the lead hazard or before a lead hazard is generated. Now let's move into part 2 of the webinar, case management. We're going to take a closer look at how the childhood lead investigation progresses from start to finish. In part 2, we're going to focus on the role of the environmental professional in responding to the referral of a case of childhood lead poisoning. As we have already discussed, the CLPPP program is comprised of a team of public health nurses and environmental professionals. Both the public health nurses and environmental professionals are involved in the management of a case of childhood lead poisoning. In part 2 of this webinar, we're going to discuss the 3 main focuses that the environmental professional needs to consider when managing a case. The first consideration: what happens prior to the home visit? In other words, what are the events that trigger the investigation of a case of childhood lead poisoning? And what steps will the environmental professional take to prepare for the lead hazard investigation? Second, how do we maintain safety in preparing for and performing the investigation? What are the safety concerns that an environmental professional must consider before performing the investigation? What are the safety concerns that we must pay attention to during the investigation? And finally, We will discuss the investigative procedures the environmental professional must follow while conducting the childhood lead poisoning investigation. We will also discuss what comes after the investigation and how we close a case of childhood lead poisoning. In other words, we will focus on how the environmental professional identifies the source of lead exposure and how we follow up to ensure the lead hazard is eliminated and the child's blood lead level is lowered to a safe level, preferably non-detect for lead. Let's look at that first consideration, what happens prior to the home visit. The first event that takes place prior to the environmental investigation is that the child's blood lead level is analyzed. But what triggers a blood test to be taken in the first place? What is it that prompts a parent or a primary care physician to find out if a child has been exposed to lead? So there are three common circumstances that result in the analysis of a child's blood lead level. The state of California mandates that medical providers must perform blood lead level tests for at-risk children at 12 and 24 months of age. The American Academy of Pediatrics recommends a schedule for all children, regardless if they are at risk or not. Most of the cases of childhood lead poisoning that our local CLPP responds to are related to the state of California requirement that all families who receive public assistance are required to have their children tested for lead. The state has this requirement in place because it is assumed that if a family is receiving public assistance, it is more likely that they could reside in older housing that predates the 1978 lead-based paint ban, which may increase the likelihood that the child could be exposed to a lead hazard. And finally, a parent or medical provider may become suspicious that a child has been exposed to lead. Perhaps a parent has reported symptoms consistent with lead poisoning. In this case, a medical provider will conduct an exam and have the child's blood lead level checked. If one sibling in the home is found to have an elevated blood lead level, the physician should also test the other children in the home, as it is likely if one child was exposed, the other children could have been exposed as well. Again, we are looking at the steps that are taken prior to the home visit. So how does a case of childhood lead poisoning get referred to the local CLPP program? First, the medical provider takes the blood draw from the child. This could occur at a hospital or a clinic. Remember, the blood draw can either be taken by capillary draw or it can be taken venously. The provider forwards the sample to the lab for analysis. If the lab detects lead in the blood, the results are forwarded to the state. If the blood lead level meets the action level of 4.5 micrograms per deciliter, a non-case is open, or they might call this a basic case. If the blood lead level meets the state definition of 14.5 or above, when one draw is taken venously, or two consecutive readings at 9.5 or above, remember that second draw would have to be confirmatory, that is taken venously, a state case is opened. All state cases and non-cases are referred to the local CLPP program, which resides in the jurisdiction where the child lives. It is the public health nurses that initially receive the case referral from the state. Once received, the nurses will forward the case to the local environmental professional. There are important steps the environmental professional must take to prepare for the environmental investigation. The first step is a consultation with a public health nurse. The public health nurse will typically reach out to the environmental professional to discuss the details of a new case. The environmental professional should ask if the case family has provided any pertinent information regarding a potential source of lead exposure, such as a lead-generating hobby or a trip out of the country. At this time, the PHN will coordinate with the case family and the environmental professional to schedule the home visit. Since the environmental professional will be taking a water sample after the water has not run for a minimum of 6 hours, the environmental professional should ensure the PHN reminded the family to make sure no one uses the main source of potable water overnight or for at least 6 hours. Alternatively, the environmental professional can obtain the case family's phone number and reach out to discuss the details of the home visit as well. During the initial contact with the PHN, the environmental professional should ask for the child's home address, as it is important to start conducting research on the property and the surrounding area. The environmental professional will determine the age of the home and check to see if there are any lead generating facilities nearby. The CLPPP program has worked with Hazmat and Jeremy Clark to develop a GIS map showing the location of Riverside County permitted lead generating facilities. The Riverside County CLPPP environmental professional can use this tool to check for proximity to the nearest lead generating facility. After this initial research has been conducted, the environmental professional will create a local case number and enter the case into an approved database, such as Envision, Access, or the like, and create a case file. Please keep in mind that cases of childhood lead poisoning are protected under HIPAA, so the details of the case child and the property must remain confidential and protected by the environmental professional. The final step that must be taken prior to the home visit is preparation of the equipment and supplies that are required to analyze the presence of lead in the home. This includes supplies needed to collect water, dust, and soil samples, such as sample containers, dust wipes, centrifuge tubes, and more. The most important piece of equipment that the environmental professional will bring with them to the investigation is the XRF spectrometer, which will be used to detect concentrations of lead in paint, as well as the concentration of lead in dust and soil. Remember that the XRF spectrometer cannot analyze lead in water, so water samples will be shipped to the lab without any preliminary on-site results. The environmental professional will ensure that XRF is fully charged and has no data from any previous inspections. If data from a previous inspection is observed on the unit, the data should be downloaded to the computer and saved to the appropriate case. At this time, it's important to ensure that safety measures are in place to protect the environmental professional, public health nurse, and case family members during the home visit. Now let's move to that second consideration of CLPPP case management, which is maintaining safety during the home visit. So why is safety such an important focus when conducting an environmental investigation? The current slide shows a schematic of the electromagnetic spectrum, which shows the range of all the types of radiation from low-frequency, non-ionizing radiation to high-frequency ionizing rays. You'll find the XRF spectrometer is located at the far right of the diagram. As already discussed, this device has a sealed source of radiation that emits gamma radiation when the trigger is engaged. As you can see, gamma radiation has the highest frequency of all the types of radiation, which makes it the most dangerous for living organisms. This potential danger is the main reason why safety is a top priority of the environmental professional in preparing for and conducting the environmental investigation. Now we're going to take a closer look at how the XRF spectrometer detects lead concentrations in a sample of paint, let's say. In the upper left portion of this slide, you'll see the barrel of an XRF is directed at an atom of lead that might be contained in that paint sample. When the trigger of the device is engaged, gamma radiation from the radioactive isotope is discharged and collides with the lead atom. Upon collision, one of the atom's most tightly held and thus highest energy electrons is ejected from the atom's K shell. When the K shell electron is ejected, an electron from the lower energy L shell takes its place. Subsequently, an electron from the next lowest energy fills that vacancy. When a lower energy electron fills the vacancy of a higher energy electron shell, a characteristic X-ray is emitted. This X-ray fluorescence is detected by the spectrometer, which can then display the concentration of lead detected in the sample, as shown in the image of the XRF screen above. For this example, 0.28 milligrams per centimeter squared was detected in a paint sample. If you'll remember from part 1 of the presentation, the standard for lead-based paint is 1.0 milligrams per centimeter squared. For this case, this paint sample would not be considered lead-based paint, since 0.28 is below the regulatory standard of 1.0 milligrams per centimeter squared. Now that we have looked at how the XRF device operates, you can see why this is the most important piece of equipment for the environmental professional, as it provides instant preliminary results regarding the concentrations of lead in samples of paint, dust, or soil. But now we can see why it is also the most potentially dangerous piece of equipment. Gamma radiation is hazardous to biological organisms, with direct contact negatively impacting organ systems in the human, as is seen in the upper right image. Since gamma radiation exposure is so dangerous, it must be maintained as low as reasonably achievable, which is known by the acronym ALARA when discussing radiation safety. In order to maintain radiation exposure as low as reasonably achievable, the environmental professional must take measures to protect his or herself, the public health nurses, the case family members, including children, adults, and pets, and all other individuals that may enter the vicinity of the sealed source of radiation. Each authorized user of an XRF spectrometer is trained and licensed to use the device and will ensure the XRF is safely stored, transported, and operated according to the office radiation safety plan. Each licensed XRF user will wear a dosimeter badge and ring when handling the XRF device. The lower right-hand image shows the dosimeter badge worn by the environmental professional. This dosimeter will monitor the level of radiation an individual is exposed to over a 3-month period. Each quarter, the dosimeters are shipped to a laboratory for processing. The annual dose must remain below 5,000 millirems. Fortunately, our local CLPPP has a combined lifetime exposure of only 12 millirems, which indicates our office has effectively maintained radiation exposure as low as reasonably achievable. The lab results from our dosimeters usually come back as non-detect for radiation. The environmental professional must also protect themselves from other hazards that may be encountered during the home visit. Personal protective equipment must be used to avoid contact with common hazards such as lead dust, chemicals, or infectious disease. N95 masks and shoe covers are generally only used when a known hazard is present, such as when responding to a complaint in which someone is actively generating a lead hazard, or when COVID-19 outbreak response policies are in place. Shoe covers may also be worn to protect floors when entering a case family's home. Gloves should be worn to avoid contact with the nitric acid that is contained in water sample bottles and should also be worn to avoid contact with dust and soil samples. Now we move to the third consideration of the environmental professional, which is performing the environmental investigation at the child's home. Upon arrival, the environmental professional will meet with the public health nurse to confirm that all consent forms have been completed by the case family, so we ensure that we have permission to enter the property prior to starting the investigation. At this time, the environmental professional may want to turn on the XRF device to allow it to warm up in preparation for calibration and operation. Ensure the device is always in the control of the environmental professional. Begin the investigation by evaluating the exterior of the home. Does the home appear to be in good condition? Is there anything out of the ordinary that might cause you to suspect the presence of a lead hazard? Are there drums of an unknown substance? Any surfaces painted bright and colorful? Are there multiple cars in the driveway that appear to be undergoing significant maintenance? If you see any condition of concern, note it and try to obtain paint, dust, or soil samples during the investigation. Also be sure to look around the neighborhood. Is there an airport nearby? A battery manufacturing plant? Make a note of anything concerning and continue with the investigation. The environmental professional will be taking lots of pictures throughout the investigation and will inform the case family of such, letting them know that the purpose of taking photographs is to help the environmental professional recall the layout and conditions of the home when generating the report, assuring the family that no pictures will be taken of case family members. The environmental professional will then draw up a floor plan of the home, which will be used to document the location of samples taken and to call out the location of any sources of lead exposure. This floor plan will be an important part of the lead poisoning follow-up form, or LPFF, which will be provided to the case family and the public health nurses. If lead hazards are identified on site, this report will also be given to the property owner to call out areas of the home that will require lead hazard control work. Throughout the duration of the home visit, the case family is often largely preoccupied with the extensive interview conducted by the public health nurse. When the environmental professional has an opportunity, an interview will be conducted with the case family to discuss any environmental conditions that might have caused a source of lead exposure. Any recent remodels will be discussed, as well as any potential lead-generating hobbies. There may be some overlap between questions asked by the public health nurse with those asked by the environmental professional, such as questions regarding imported items from out of the country, such as spices, candies, and medicines. Or, have there been any recent trips out of the country? What is the family's main source of drinking water? Where does the child play? All these questions will help the environmental professional to know where to focus during the investigation. It is important to note that when COVID-19 protocols are in place, the environmental professional will be the only CLPP team member on site. In this case, extensive infection control procedures will be followed to reduce or eliminate contact between case family members and the environmental professional, as well as to limit contact with the surfaces of the home and to prevent contamination of equipment and supplies. In some cases, the home visit will be deferred, and a remote environmental assessment will be performed over the phone in lieu of the home visit until it is determined the home visit can be performed safely. Upon entering the home, the case family will be informed that an area needs to be made available for the environmental professional to set up the equipment and supplies needed to take and analyze environmental samples. Here are two examples of what the workstation might look like during the investigation. The family will be informed about the sealed source of radiation contained within the XRF device and that they need to restrict family members from going near the XRF device. Children should not be allowed near any CLPPP supplies or equipment. All trash, such as gloves and wrappers, should be collected by the environmental professional and removed from the home at the conclusion of the home visit. After the photographs have been taken, the floor plan has been generated, and the workstation has been set up, it's time to start collecting the environmental samples. Houses that were built prior to the 1978 lead-based paint ban are required to have more environmental samples taken than homes built after the ban. This, of course, is because homes with lead-based paint are more likely to contain a source of lead exposure than those built after the ban. The environmental professional, however, will use their judgment when determining if additional samples should be taken, no matter the age of the home. For instance, a new home might have surfaces with various brightly colored paints throughout the home. In this case, additional paint samples above the minimal requirement should be taken, especially if the case family doesn't know where the colorful paints were purchased. If a lead-generating hobby is reported or observed, several dust and/or soil samples should be taken in the area of concern. When it comes to what order to collect samples, it is important to start by taking the water sample first. This is because the case family has likely refrained from using their main source of water for at least 6 hours or overnight, and they might desire to resume cooking or cleaning activities that would require the kitchen sink faucet. For this reason, the environmental professional may decide to take the water sample shortly after arriving, even before the activities described in previous slides. Once the XRF device has been warmed up and calibrated, the environmental professional can begin taking paint sample readings throughout the house. Several building components will be tested for lead-based paint, such as windowsills, door frames, and walls. The environmental professional should always ensure there is no one positioned on the other side of a component being sampled, such as a family member standing behind a door or on the other side of the wall. This, of course, is due to the sealed source of radiation that is emitted when the trigger is engaged. After the paint samples have been read with the XRF, the environmental professional can begin collection of dust and soil samples. Dust samples will be taken on floors, windowsills, and other internal and external horizontal surfaces, while soil samples will be taken in play areas and at the drip line around the perimeter of the house. Keep in mind that each environmental sample location should be marked on the floor plan as each sample is taken on site. That way it can be accurately documented where the sample was taken without having to try to recall each location later. During the investigation, the environmental professional may become aware of non-housing items that should be tested as well. Perhaps a ceramic water dispenser is observed. In this case, a water sample should be collected for lab analysis, and a lead check swab should be used to test for lead on site. Perhaps there are ceramic kitchen items used for cooking or serving. These will be tested with a lead check swab as well. Although the public health nurses typically use lead check swabs to test ceramics, toys, and so on, the environmental professional can also perform the lead checks. In fact, when COVID-19 protocols are in place, the environmental professional will be conducting all the lead check swab tests in the home. For items imported from outside the United States, the environmental professional will collect items such as candies, spices, and medicines for laboratory analysis. While paint, dust, and soil samples are analyzed on-site with the XRF device, non-housing items are typically either tested with a lead check swab or sent directly to the lab for analysis. Some non-housing items, such as imported spices, can be tested on-site with the XRF. Once all the on-site results are available, the environmental professional can provide preliminary recommendations to the case family to protect children from any suspected lead hazards. If a non-housing item is suspected to contain lead, the environmental professional should advise the family to restrict the child's access to the item or consumable. When COVID-19 protocols are in place, all dust and soil samples are also sent directly to the lab without preliminary on-site XRF analysis, thus limiting the preliminary recommendations that can be offered to the family, but also limiting the time that the environmental professional is on site. Once the environmental investigation has been concluded, the environmental professional will return to the office and prepare the samples for shipment. The first part of the LPFF report is actually the chain of custody form that must be sent along with the samples to the lab. The environmental samples should be checked to ensure they were properly labeled and that each sample is called out on the floor plan. The water bottle samples should be tightly sealed and double bagged. The dust swipes will be placed in sample bags, which are each placed in a centrifuge tube with a cap. The soil sample test cups will be placed in a tight, sealable bag. The environmental samples will be sealed in a box and shipped to a third-party lab via FedEx. It is important to note that all non-housing samples collected will be shipped directly to the CDPH Environmental Health Lab branch, which is a different destination than the water, dust, and soil samples. The environmental professional will need to obtain permission from the Environmental Health Lab branch prior to shipping the non-housing samples. The lab results for water, dust, and soil are generally received within 1 to 2 weeks, while the non-housing results have a much longer turnaround time, sometimes up to even 1 year. Here we have a lab report for 4 dust samples. The lab report will be reviewed to see if any samples were above standard. In this case, all dust samples were below standard. Notice there was a blank analyzed as well. The environmental professional is responsible for shipping the blank along with the other collected samples. A blank does not have to be included for water, soil, or non-housing samples, just for the dust samples. Here is a lab report from the CDPH Environmental Health Lab branch for non-housing samples, or in this case, spices. The family had imported several spices from Afghanistan. The lab results revealed that the turmeric contained a dangerous 7,700 parts per million of lead. The case family and public health nurses were immediately notified of the lab results. It is important to be aware that non-housing samples actually fall under the case management of the public health nurses. So why does the environmental professional collect and process the non-housing samples? The guidance manual for the environmental professional allows for the collecting and processing of non-housing samples should the environmental professional choose to assist the public health nurse in this way. The environmental professional will generally decide to assist with non-housing sample collection and shipment to facilitate efficient processing of all samples collected at the home. However, since the non-housing samples fall under the purview of the public health nurse, the environmental professional does not need to wait until the non-housing results are in prior to determining if the environmental investigation can be closed. If the sample results confirm that there were no environmental lead hazards identified, the environmental investigation can then be closed. The environmental professional must have the on-site preliminary results obtained from the XRF device, together with the results of the lab analysis, in order to determine if there were lead hazards at the home. Once the lab results for the environmental samples have been received, now we have all the information necessary to confirm if a lead hazard was present and complete the lead poisoning follow-up form, or LPFF report. Once completed, the LPFF report will be forwarded to the public health nurse, who will discuss the results of the environmental investigation with the case family. If environmental sources of lead exposure were identified, the LPFF report will also be sent to the case family, as well as the property owner if the case family does not own the home, along with a notification letter indicating what the lead hazards were, where they were located, and what type of remediation needs to take place in order to close the case. It might be a good idea for the environmental professional to reach out to the case family and/or property owner directly to discuss the details of the lead hazards observed, as well as to discuss the requirements or recommendations to reduce or eliminate the lead hazard. The public health nurse should also be forwarded the property owner notification letters. If an environmental lead hazard was identified, the property owner will then have to complete the lead hazard control work as prescribed in the property owner notification letter. The property owner must ensure lead-safe practices are followed when remediating a lead hazard. A detailed guidance will be provided along with the property owner notification letter. The environmental professional will follow up with the property owner after 30 days of issuing the notification letter to ensure that the lead hazard control work has begun. The property owner should complete the lead hazard control work within 90 days of receiving the letter, at which time the environmental professional will contact the property owner to ensure the work has been completed. Once the property owner indicates that the remediation has been completed, a clearance investigation will be scheduled. The environmental professional will return to the home to conduct a visual inspection, checking for the presence of dust and/or checking to see if paint has been properly stabilized, and will collect additional dust and/or soil samples to be sent to the lab. Preliminary on-site XRF readings for dust and soil are not necessary for clearance inspections. However, readings can be taken on-site at the discretion of the environmental professional. Once the lab results are received, the environmental professional can confirm if a lead hazard is still present. If no environmental lead hazards are identified, the environmental investigation can then be closed. If lead hazards are still present, an additional property owner notification will be issued, and the process will be repeated until there are no longer environmental lead hazards identified at the home. Once clearance is achieved, a clearance LPFF report will be generated, as well as a clearance letter. The clearance LPFF and letter will be issued to the property owner, case family, and public health nurse. Once all clearance reports and letters have been forwarded to all parties, the environmental investigation is now closed. The environmental professional will ensure that all documentation from this case of childhood lead poisoning is processed and securely filed with all email correspondence. Remember that HIPAA compliance regulations must be followed, as each record contains confidential information. Once the environmental investigation is closed, the environmental professional will likely no longer be involved in the management of this case, which is likely still open and being managed by the public health nurse. The public health nurse will continue to follow up with the case family to check on the child's well-being and to ensure the blood lead level is decreasing. If the child's blood lead level does not decrease or starts to increase, there is a likelihood that the public health nurse will contact the environmental professional to conduct a second environmental investigation to see if perhaps there was a lead hazard that was not identified at the first environmental investigation. However, If the child's blood lead level continues to decrease with proper nutrition, hand hygiene, and the removal of the source of lead exposure, the public health nurse will eventually be able to close the case as well. It is unfortunate that an almost hazmat level response is required for identifying and eliminating lead hazards in items and substances that some children encounter every day. At the Riverside County Childhood Lead Poisoning Prevention Program, our mission is to protect children as best we can from exposure to lead hazards in all forms. It is our hope that this presentation has helped you to understand lead poisoning better and how you too can help prevent lead hazard exposure in children and adults alike. If you are interested in obtaining more information about this program, please feel free to contact us at the Riverside County CLPPP program.